When you hear the word loss, what comes to mind? Maybe it's sadness, emptiness, loneliness, or even something else. Loss can mean a lot of different things to all of us, but what does it actually mean to you? It's normal to avoid thinking about loss, especially when it comes to the loss of a person to death that you cared for and loved very much. And that's why I'm here today to help you learn more about dealing with the loss of your loved one. I'm Dr. Kristie Overstreet, psychotherapist, and I want you to know that you're not alone. We've all lost someone that we've loved to death, whether it's a friend, a family member, a work peer, or someone in our community. And dealing with the death of a loved one can leave you feeling helpless because all you want is to have that person back and you can't. You've got no control over the situation and you can't fix it, which can make you feel even worse. Grieving with this loss affects every area of your life, such as how you show up in your relationships. You might pull away, shut down, become easily angered, or quick to snap at your partner or your family. It also affects how you act as a parent. You might pull away from your kids, spend less time with them, and maybe be easily irritable and even shut down your emotions around them. It also affects how you show up at work. You may take time off of work to grieve, or you might be the person that drowns yourself in work to avoid dealing with the grief, the hurt, and the pain. It also affects your sleep. It's hard to go to sleep because of how much pain you're in, but you're so exhausted and can't function. You want to sleep, but you can't sleep. You can't sleep, but you want to sleep. Your loved one can even show up in your dreams, or you think about them, or they come to you in the middle of the night when you try to sleep. Your eating's also affected. There's a period of time where you won't have an appetite, nothing sounds good, and you're going to have to force yourself to stay hydrated with fluids and to have something on your stomach. And of course, your self-care is affected. These are those things that you do to take care of yourself. It might be working out or exercising, spending time with your friends, hobbies, or interests that you enjoy that you did a lot more of prior to the loss. But due to the grief you're going through, these things suffer. Maybe you're not spending as much time doing them, or you're kind of putting yourself away and avoiding them because you don't want to do anything that brings you pleasure because you're in so much pain. Remember that grief looks different for each of us. For example, one person may be grieving their loss by crying often and this tearfulness that comes up even in situations that you wouldn't expect tears. And you can look at this person and you can tell they're really struggling. But another person may be going through the same grief, but they may not be shedding tears. They may not be emotional, and you might look at them and can't tell they're struggling. We have to be careful not to make assumptions about people based on what we see on the outside. There are many people struggling with grief and loss, and you'd have no idea because what you see on the outside does not match how they're feeling on the inside. You need to know that there is no wrong way to grieve. So be aware to not assume what a person is experiencing based on that outward appearance. If you're the one grieving and this sounds familiar, meaning that inside of you, there's all these emotions, you hold it together, you keep it together, you don't show anyone how you feel. I want you to know it's okay, but you're going to want to talk to somebody at some point about what you're experiencing, whether it's a loved one you trust, a friend, or a confidant, or a therapist. You got to take time to process what you're going through. If you don't, the feelings that you're experiencing inside, that pain, hurt, all that stuff, and then stacking, and it's got to come out at some point. And more than likely, it's not going to come out in a healthy way, which might end up hurting you worse or those you love worst. You might pull away from those that are trying to help and care about you. You might be avoiding issues in your relationship because of what you're going through. And you all have unresolved grief that can turn easily into depression if you're not careful. Also, grief can stir up previous mental health issues that you may have dealt with in the past or experienced recently. This is why you've got to take care of yourself and do what you need to do at this part of your journey. I know the idea of talking to a therapist for the first time can cause you to feel anxious because it's a lot of unknowns. You haven't done it before, so feeling uncomfortable and unsure about that is totally normal. But don't let that stop you from reaching out to get the support that you deserve. Just so you know, there's a lot of different therapeutic approaches and they differ with each therapist. A few common ones when it comes to grief and loss is grief interventions, eye movement desensitization and reprocessing, which is commonly known as EMDR, rapid resolution therapy, which is known as RRT, and various trauma works. I want you to look for a therapist that has experience in grief and loss, which can be seen on their website or on their profiles. I want to encourage you, reach out to the therapist that you find interesting or that you want to work with. Give a little bit of background information about what you're going through. You don't have to write a whole chapter, but put what's happening for you, because it helps that therapist figure out if you're going to be a good fit for them. If you feel comfortable with what they share and their process of moving forward, go ahead and set up that appointment. Again, it's totally normal to feel unsure or nervous about that appointment. I also encourage you to make a few notes to bring to that session that you want to discuss, because in the middle of a session, it can be hard to remember those things that you want to talk about. So making a couple notes beforehand is always a good idea. You deserve support, strategies, and tips to move forward through your grief, and you don't have to do this on your own. So seek the support you need. I also want to share a couple of helpful tips that I use with my clients that helps them navigate through the grieving process, regardless if you decide to work with a therapist or not. Number one, don't put a time limit on your grief. This is a big mistake I see many people make after they lose someone. They use words like should or shouldn't, such as, I should be over this by now, or I shouldn't still be upset when they're talking about their loss. The truth is, you can't put a time limit or expectations on what you should or shouldn't be doing when it comes to grief. That's not how the process works. Because then all you're left with is feeling shame or beating yourself up that you're not doing something right, that you're supposed to be in some place you're not. That's not how it works. So do not put a time limit on yourself through this grieving process. Number two, it can feel like the pain will never stop. When you're dealing with the loss of a loved one, you will feel the horrific pain your experience is never going to stop, and that's normal. I want you to know that the pain may never completely stop, but it will lessen in intensity. Sure, things will never be the same as they were before your loved one passed away, and your life and those around you is forever changed, but it's not going to continue to feel the way it does right now for the rest of your life. Remembering this is going to help you during those really tough days to know that the pain will lessen in intensity as time passes. Number three, you're going to want to accept that you're not going to get the answers you're looking for. Common statements that my clients ask, as well as I've asked myself through the loss of loved ones, is, why did this happen to them? They're such a good person. They're too young. They did so much for the community. Why were they taken away? Why was it them and not someone else? These are just a few of the common thoughts that come up when we lose people that we love. And the toughest part for us is that we won't get answers to these questions, because death and life is just not fair. And it isn't right that our loved one was taken from us. And this is a part of the acceptance that will help you in knowing that these normal questions will come up and that you're not going to have an answer. Number four, I want you to feel whatever you need to feel. This one that surprises most people when it comes to grief, because they don't expect the irritability that comes with it. Think about it. You've lost someone you love so much, and the people you care about trying to help you, they say things to you such as, everything happens for a reason, or it's going to get better. Or they have all these sayings and these affirmations or mantras that they say. They're trying to help you, but it makes you feel more angry, more irritable, more frustrated. These people care about you. They're trying to help, but it can feel like it hurts because it makes it worse, because you feel like no one understands because maybe they've not been in your exact shoes. This is totally normal. Those people don't know what to say either. They're just trying to show up in a way they can, even if it actually isn't really helpful. Keep this in mind, because you don't have to respond to them or reply in some way. You can simply say thank you or okay, or nod your head. Don't feel forced that you've got to act a certain way or that you have to hide whatever you're feeling to make other people feel more comfortable around you. If you feel irritable, angry, upset, be irritable, angry, and upset. It's a part of the process, and you're going to want to give yourself space and give yourself grace to allow yourself to feel, because there's no wrong way how to do it. The fifth is, I want you to talk about your loved one when you're ready. As you go through the grieving process, there's going to be times when you don't want to talk about the loved one you lost. You may say things such as, don't bring them up, I can't, or things similar, because if you start talking about them, the tears are going to come and you're worried you're never going to stop crying, or you don't want to think about it at the time, or it's really inconvenient time to talk about it. This will pass as you grieve. And with time, you'll want to talk about them and share memories. There's no right time when to do this except when you're ready. Don't force yourself to do something that doesn't feel right for you. So when you're ready to share and talk about those memories, you determine when that is, nobody else. Whether you talk about them to someone, whether you write about them, you journal, or whatever way you process it, this is a grieving process and it's okay because it's yours. I don't want you to judge yourself for how you go through this journey. Just remember to reach out and let others support you through it. You're not alone and you don't have to navigate this by yourself. You deserve support, hope, and to give yourself grace as you go through this difficult part of your journey.